Welcome, bienvenidos, bienvenidos. We are very happy to have you with us today. While we wait for everyone to join, please say hello and write your city and your country in the chat. You can find the chat in the Zoom platform. For everyone that is joining us today, we are just taking a minute to get started. We are waiting for cities and countries to start the conversation. For the cities and countries that are joining us today, welcome, bienvenidos, bienvenidos. We're very happy to have you with us today. We are just waiting for a couple of minutes to have everyone joining. So please say hello and write your city and your country in the chat. Thank you. We already have Bogota, La Paz, Sao Paulo, Copenhagen is with us too. Santiago de Chile, welcome. Very good. Let's give it another minute and we'll get started. Bienvenidos, Fortaleza. Thank you for joining us. Y Mérida, bienvenidos. Lima, bienvenidos. Yopal in Colombia. Great to have you with us. Montevideo. Very good. So I think we are ready to get started. Please continue writing your city and your country. Say hello. We are very happy to have you with us. Today's presentation is in English with simultaneous translation to Spanish and Portuguese. So please identify at the bottom of your screen a little sign with a word that says interpretation. You can test it now to see if you can hear us in Spanish and in Portuguese. I also would like for you to download the presentation in Spanish and in Portuguese. Follow the link that is in the chat. For the new cities that are joining us, we have simultaneous translation to Spanish and Portuguese. You can find that at the bottom of your screen. There is a little sign with the word. You can click on that and select Spanish or Portuguese. After doing that, please follow the link in the chat and download the presentation in Spanish or Portuguese. Today's webinar will go in depth into what is the barriers that we have to overcome in the safe system approach. We have a panel, a wonderful panel of global experts that will be answering your questions today. This is today's agenda. And as you can see, we have our global director, Sergio Veleda, is our global director of urban mobility for the WRI Ross Center for Sustainable Cities at the World Resources Institute. And he will kindly get us started. Sergio, please.
Thank you very much, Claudia. Thank you. We are very happy today to have you on this first step of this amazing journey to develop road safety and vision zero approach for cities in Latin America. I want to say some words as an introductory on behalf of WRI and on behalf of all organizations that organize this webinar. When a city decides to engage in a project that will develop vision zero to manage traffic, it assumes an ethical position, life first. First of all, so I want to congratulate all of you and your mayors on the decision to engage in this journey. Please convey my admiration and respect for your mayors. No death in traffic can be acceptable. Another sector many years ago adopted the same philosophy. Aviation became a way of traveling where people's lives and safety comes first. So we need to reproduce the same vision on the traffic. We must overcome the view that only the driver, the pedestrian, and cyclist are responsible for their safety. It would be like an airline company to consider that the only responsible for the plane's safety are the pilots and the passengers. It's not correct. We are all responsible. The public sector, represented here by you, has a fundamental role in developing policies that do not condemn death to a person who just wanted to move. When we are talking about Vision Zero, always I remember an Uruguayan writer called Eduardo Galeano. Eduardo Galeano has a very good definition about utopia. Sometimes, especially when I was secretary here in São Paulo and we launched with WRI the Vision Zero approach in the city, a journalist asked me, but no deaths in the traffic, it seems a utopia. And I remember this definition of utopia from Eduardo Galeano, and I want to share it with you. Utopia is on the horizon. I move 2 steps closer, it moves 2 steps further away. I walk another 10 steps and the horizon runs 10 steps further away. As much as I may walk, I will never reach it. So what's the point of utopia? The point is this, to keep walking. Today we start a journey with you to support you, to join with you this way to eliminate deaths and injuries in the traffic. It's possible. We can do it. We have many examples around the world, and you will hear about it during this webinar series, that it's feasible, it's possible, and it's an ethical decision. We must do it. So, please, Claudia, I want to welcome all of these cities. Arequipa, Peru, the city where Claudia was born. Welcome. Belo Horizonte, Brazil, in Minas Gerais. Buenos Aires, this amazing city in Argentina. Bogotá, the city, the closest city, the city that is close of the stars. I love this title of Bogotá. Cali in Colombia, welcome. Curitiba, the city when I was born, welcome Curitiba. Colima, the beautiful city in Mexico. The historic city of Cusco in Peru. Fortaleza, They are doing an amazing job in road safety. Guadalajara, amazing Mexican city. In Dayatuba, very beautiful city in São Paulo, in Brazil. La Paz, so high, beautiful city, welcome. Lima, Peru. I hope we will have time to receive some ceviche guidance from you. Thank you very much for joining. Medellin, Colombia, welcome. Mérida, Mexico, beautiful city. Montevideo, the beautiful city on Uruguay, the capital of Uruguay. Pachuca, Mexico, welcome. Bienvenido, Pachuca. Rosario, Argentina, the city beside the Iguaçu River, the Paraná River. Thank you very much, Rosario. Salvador, Brazil, welcome, Acarajé. Santiago de Chile, Los Angeles, and welcome. São Paulo, I'm here just right now, welcome São Paulo. San José de Costa Rica, beautiful city in the Central America. San Salvador, the El Salvador, welcome. And Santa Cruz de la Sierra, Bolivia, warm welcome for our journal. Please, next slide. I'm so glad to present to you the organizations that organized this webinar series, this Vision Zero Challenge. We want to thank you, all of these organizations, because the commitment that they have with this program and this project and with the road safety. WRI, FIA Foundation, Fundación Gonzalo Rodrigues, Inter-American Development Bank, International Transport Forum, ITF, Latin CAP para autos mais seguros, Towards Zero Foundation, Vision Zero Academy, UK Aid, GRSF, Global Road Safety Facility, and the amazing World Bank Group. Thank you everyone for support and for your commitment with this agenda. Next one, please. And of course, thank you for our sponsors who support us and who made it feasible. 3M, amazing American company who is in the road working to develop new products and new technologies to help cities and people. PTV Group, the Mind of Movement, and Volvo Group, thank you very much for your support on this project. Now, please, Claudia, I want to present you these amazing speakers that you join this journey. I want to ask for each one to introduce themselves, a brief introduction. You will have today the opportunity to hear this very, very important panelist who has a big experience, amazing experience to share with us. Thank you very much for joining us. Please, Klaus, we will start with you, your introduction.
Thank you, Sergio. Yes, I am Claus Tingvall. I am from Sweden, where at least parts of this journey started, the Vision Zero journey. And I was a part of it already from the very beginning, where a lot of people thought it was ridiculous. I am a retired director of traffic safety from the Swedish Transport Administration, and I'm also a professor in injury epidemiology, I should say. Epidemiology is really something big nowadays, but it's about injuries, about kinetic energy instead of virus, that is the virus. Very glad to join here today and looking forward to the seminar. Thank you.
Thank you, Klaus. Thank you very much. Please, Eugênia Maria Rodrigues, who is in Washington, D.C., a Brazilian doctor, please, your introduction.
Good morning, everybody. My pleasure to be here. I'm Eugênia Rodrigues. I'm a physician by training. I'm epidemiologist as well. And I'm the regional advisor on Pan American Health Organization since 2005. And so I'm very glad to be here. And so please ask me the relation with road traffic injuries and non-communicable disease prevention. I'll be more than glad to discuss with you about that. My pleasure. Thank you.
Thank you, Eugênia. Please, Fred Wegman, your time to introduction. Thank you very much, Fred.
Good morning to you all. Good afternoon to people here in this part of the world. My name is Fred Wegman. I'm from the Netherlands. As Klaus, I'm retired as well. I'm an emeritus professor of traffic safety in Delft University of Technology, and I was for quite a while the managing director of the National Institute for Road Safety Research, SWAF, in the Netherlands. I saw the list of participants and I welcome quite a couple of my students, and it's always good to see them here on the list and still active in road safety. And last but not least, I'm one of the founding fathers of the safe system approach in the Netherlands. And perhaps I have an opportunity to discuss that with you in a while. Thank you very much.
Thank you, Fred. I want to ask for the cities that is joining just right now, please share in the chat your name and the city where you are. Thank you very much. Stuart Ryde, please, your time to present from London. Thank you very much for joining.
Good afternoon and hello everybody. My name is Stuart Reid. I work for Transport for London, which is the strategic transport authority for the whole London area. My role is to coordinate our delivery of our Vision Zero plan. We have learnt a great deal in putting our plan together from people from other cities, such as New York, from people like Klaus and Fred, and that's been incredibly helpful to us, and it's our obligation to share what we've learned. So I'm very pleased to be with you. I hope you find it useful. Thank you very much.
Thank you, Stuart. Now our colleague from Gothenburg, Sweden, Susanne Andersson.
Hello, good morning and good afternoon, wherever you are in the world. I'm Susanne Andersson and I'm working for the city of Gothenburg in Sweden. It's the second largest city in Sweden. And I'm working with the Vision Zero. And I look forward to sharing the experiences that we have had in Gothenburg and the knowledge that we have built. And a special greeting to Bogota, Sao Paulo, and Fortaleza, who I had a pleasure of meeting before. And they do a fantastic, fine road safety work. I've been working with road safety in Gothenburg for a couple of decades with road safety programs, goals, strategies, and street design. And I also had the opportunity to follow and be a part of the rapid technology development that's taking place with new mobility services, new vehicles, and automation. And we want them to contribute to better road safety as well. So you can ask me about speed management, the use of data on injuries and crashes, and also maybe some questions about technology and speed management. Thank you.
Thank you, Susanne. Welcome. Thank you for joining. And now the last but not least, our colleague Matthew Baldwin from European Commission. Thank you very much, Matthew, for joining. Please, your introduction.
Hi, Sergio. Delighted to be with you for Vision Zero Challenge for Latin America. What a huge honor and a privilege to join this panel with great examples of cities who've shown such leadership here in Europe. And if I may pick out two of what Fred described himself as one of the founding fathers. I see Fred and Klaus as the godfathers of the safe system and the Vision Zero approach, with everything that implies. And don't believe a word what they say when they say they're retired. That just means they have more time to think, so they're even more dangerous than they ever were. It's really an honor to be on the panel with them. Who am I? I'm Matthew Baldwin. I have the best job in the world, which is I am the European coordinator for road safety and sustainable mobility. These issues are indelibly, wrong word, umbilically joined together. And I want to talk about that today and hear your experiences.
Thank you, Matthew. Thank you very much. Next slide. I want to thank you, everyone who is joining this webinar. And I want to ask you, if you want to ask something for our panelists, please don't be shy. Please use the chat to address your questions and your comments. It's important to have your participation, to have your contribution. Please, again, don't be shy. Don't hesitate to ask or to comment on the chat. Thank you very much. I hope we will have a great session today. And just right now, I want to ask my colleague, Claudia, who is responsible leader of this initiative, to continue the agenda. Thank you very much. Claudia, it's over to you.
Thank you very much, Sergio, for your wonderful welcome to all our cities. We are seeing more cities coming. Welcome, Villavicencio, Colombia. Great to have you here. All right, and we are going to continue by giving you some updates on the Vision Zero Challenge. As you all know, the Vision Zero Challenge is a rallying cry to city leaders to save lives by taking bold actions on road safety. It aims to spotlight the importance of moving from vision to action. We want to build momentum, to spur action in cities, to share knowledge, and to work with leaders. How are we updating the Vision Zero Challenge? So we have to delay the start of the webinar series due to the pandemic. We were ready to get started in March when our cities started having serious issues with the pandemic crisis. So we are removing the minimum participation for 2020. We are extending the timeline throughout 2021 to provide added support to cities. We understood that the first months of the pandemic were really hard for cities, and it was very difficult to concentrate beyond responding to the needs of this crisis. So we are starting now with the webinars, and we are going to continue towards the end of the year. Next year, we are going to be working with the cities on their projects. We are adapting content to include pandemic-related themes, for example, cycling, emerging cycle lanes and cycle infrastructure. We are inviting cities to identify a project to work on and discuss during 2021. We're going to have this webinar series rather than a finished project to be judged on. We will be selecting Vision to Action champions based on ongoing engagement. And finally, we are adapting prices to pandemic conditions, meaning that if we offer some travel, that is restricted and we're going to have to shift. Finally, keep joining our webinars for more updates. What are the benefits of all your cities to joining the Vision Zero Challenge? Well, you have seen with the introduction of these 6 amazing experts. So the first is to really connect with a network of leading global road safety organizations and leaders, exchange knowledge and expertise with other cities in Latin America. Embracing the safe system approach is definitely a new change. It's not going to be easy to make that shift by ourselves. We have to do it as a community. We will win recognition and trainees as Vision to Action champion, and we will be seen by a global audience of road safety and urbanism professionals. In today's discussion, we are focusing on overcoming the barriers to the safe system approach. So let me recap, what is Vision Zero? Vision Zero is a global movement to end traffic-related fatalities and serious injuries by taking a systemic approach to road safety. The premise of this strategy is that the road deaths and injuries are unacceptable. They are preventable. First implemented as the national road safety policy in Sweden in 1997, Vision Zero has now been adopted by more than 20 cities around the world. Behind the Vision Zero branding is the safe system approach. These are the 5 principles that we have identified around the safe system approach. The first one, and it seems almost self-explanatory, is that we humans make errors. The issue, the problem is that we have designed our systems for perfect people, and that doesn't exist. On top of that, humans are very vulnerable to injury. Our bodies are not prepared to absorb kinetic energy. That means when we are hit by a vehicle, our bodies will not be able to withstand that. That's why the responsibility has to be shared. No deaths or serious injuries are acceptable. It's an ethical rule, but we also have to understand that this is something that other countries are already achieving. And finally, we have to be proactive and not reactive. That means that we have already 1,350,000 cases every year where people die in traffic crashes. We know what is happening. We have to understand what are the solutions and not waiting for the next victim. When we look at the whole framework, you can see on the left these principles that are really the foundation of the safe system approach, but they need to be underpinned by core elements. Economic analysis, I have to give you a piece of bad news today. Road safety is not a priority in the agendas and probably will not be a priority. We know that is an enabling element that will allow for people, for example, to walk and bike, for us to have better quality of air, more equity. So it's a very important piece of all the other benefits in the society that we need to achieve. We need to make a very strong economic analysis of why we need to invest in road safety. We have to have priorities in good, strong planning, monitoring and evaluation, and if there are certain things that we have done and we need to modify, we need to adjust, we need to improve, we need to allow for that space. Comprehensive governance and management, and finally, strong targets and data. The action areas that we propose are 8, but they are not a straitjacket. We can allow for a space for other areas if need be. But we are starting from the macro pieces, the land use planning. We know that if we travel more, the risk gets higher. So we need to have a good land use planning. Also because if we have cities that are denser, not sprawl, then we're gonna have people taking mass transportation, walking and cycling, which is absolutely key for sustainability, for climate change, for equity, for our health. Improve mobility options. Of course, enforcement, law, and regulation in place are very important. Vehicle design and technology for everyone around the world. That means that in Latin America, we should have the same safety standards as the vehicles have in Europe or in Asia, for example. Street design and engineering, absolutely important. One piece, which is at the core of the safe system approach, is speed management. We need to have speeds that are safe. Education and capacity building, and in this one, I want to stop to say that we are talking here about education for those that are gonna build the system, the engineers, the decision makers, the urban planners. Those are the ones that need to have enough research and tools to be able to build and deliver a safe system. And finally, post-crash emergency response and care. When we have safer, healthier environments for all, we start a positive loop for safety. We can increase cycling and walking, which is the first barrier. When we don't feel safe, then we opt to surround ourselves by a skill, protecting us with a vehicle. That will reduce vehicle travel, which at the time will reduce emissions and air pollution and will lead to fewer crashes and fatalities. Now today, we are going to talk about the barriers to implement Vision Zero. This is a topic that we have been discussing already in Latin America, and we know that you all want to have 0 fatalities and 0 injuries in your cities and countries. The question is how we do it. And there are many barriers that are on our way. So today we are going to list the barriers, and you are going to get ready because you are going to vote, and we are going to have 3 selected at the end that we will discuss with our panel. All right, let's go to the first one. The perception of road safety as a personal responsibility. That means it's everyone that has to take care of themselves. We cannot do anything to change the system. The second, concerns that the regulation of street design changes will increase congestion, which is a very important concern. Third, concerns that regulation of street design changes will increase air pollution. Concerns that reducing private vehicle circulation will negatively impact our economies. Cost of planning and implementation, lack of integrated or dedicated funding. Lack of adequate data for diagnosis, planning or monitoring solutions. Lack of political leadership, vested interests, influential motorists or voters. Lack of technical knowledge, lack of diversity of perspectives in mobility planning, and finally, the perception that the safe system approach is a luxury for rich countries only. Very good. Now we are going to turn to my colleague Alejandro, and he will guide you on the Menti.
Thank you very much, Claudia. And I have shared the link and the code that everyone can go ahead and enter. You can go to that website either on your phone or your computer and then enter the code placed there. And I'm going to go ahead and share my screen so I can show you the results. So now that you can see my screen, here you can again see the question, which is which barriers have you experienced? And all those barriers Claudia mentioned are listed in the x-axis. So you will be able to see those options on the website when you go in and have entered that code. And you can choose as many as you want that are applicable to your situation. This will take just a moment to refresh. And we're gonna give it just about 2 minutes while the system refreshes and enters the information. Okay, we start seeing some responses. So we'll keep the answers coming for a couple minutes before we move on to the next question. Okay, we start seeing a couple more answers. Excellent. So we see quite the diverse responses across the board. And we're gonna give it just 1 more minute to give everybody a chance to enter their answers. Thank you all for taking the time to do this. And thank you to the technology for collaborating thus far. Okay, so we're gonna move forward to the next question. Now we get the same questions, the same 10 options across the board in the x-axis. And you should shortly, on the same website where you entered your responses, be able to see the next question come up, which is, what are your top 3 greatest barriers? So this time around, you have the same options, but you only have the option to enter 3 answers. So you have to enter the 3 that are most applicable to your situation. And again, we're gonna give it a minute or 2 for everything to refresh. It may take a minute as well for this new question to appear on your website. You can also try to refresh the page. There we go. So now that fewer options are available, we start seeing a couple of these being more prominent than the others. I'm gonna give it a couple more minutes just to give you all a chance to enter your responses. Very interesting. Gonna give it just 1 more minute. Excellent. Thank you very much for entering your responses. We will share the results with you after this event. And over to you, Claudia.
Thank you very much, Alejandro, and I'm so happy the technology worked well. So we now have identified our main barriers. And I would like to ask our panelists to now turn on your cameras because we're going to start the conversation. Very good. So according to our Menti, we have 3 that are the most important ones. Probably not very surprisingly to you, the first one is the lack of political leadership. All our cities are feeling that that is really a big issue, and then how do we get around that one? The second one is that safe system is really for rich countries, and there is not much to do in our countries at this point. And finally, the third one is that road safety is really a personal responsibility. Each person has to take care of herself, himself. So we're going to start with the conversation, and I'm going to ask you, what are your thoughts about the political leadership? And maybe I will get started with Claes Timberg to see if in Sweden, when you were working back in the 90s, you had the support of everyone in the political class to have Vision Zero. How was that in Sweden, Claes?
They're wonderful questions, and I even like the answers even more because they're bundled together, as you say. But let's start off with the first one, with about political leadership. Yeah, we we were very lucky because we had a minister of infrastructure, of road and rail infrastructure, that was really so interested in traffic safety. And we had worked out a little bit that she was in occupational health and safety area. So we compared roads and the situation there with the sort of environment for working, or the working environment when it comes to safety, and said, you know, it is really the employer who has the responsibility for the employed, those who are working there, their safety. Why not have the same idea on the road? And that sparkled the political interest so much. And the other thing, of course, was that you should have a target that really is, yeah, utopian, but then you will be sort of compared with that, with the Horizonte, rather than just some tiny target just showing some kind of direction then. But I think sort of in those days, it was more about being lucky. Today, it's more like we need benchmarking, comparison between cities, countries, companies, cars, whatever it might be, to set a benchmark that really shows that you can really do something really sort of, you know, far-reaching or reach goals or targets that are quite far away. So I think that plays a role. But I just want to add, and I know many will talk here now, but I just want to add, today, as you know, it's more about what you talked about, Claudia, in the beginning, and that is to say that, you know, you can't sort of just, it's not only about road or traffic safety, it is about quality of life, it is about climate, health, equity issues. And that, I think, make traffic safety a bigger issue is about bringing it together with other policy areas as well. Then I think today it's a little bit easier. Thanks.
Thank you very much, Klaes. And now I want to turn to the Netherlands. The Netherlands also underwent a big, deep process in the 70s. I remember the story of that famous journalist that lost a child, Fred. Can you tell us how was it, and if it is easier to work on road safety nowadays in the Netherlands?
Okay, it was a battle. It was not an easy way forward. It was not that we had a high political priority for road safety. I have to be honest with you, we have never had that in the country. It was never a top priority. However, we managed to bring it to a certain level of priority for the politicians. And that was a hard work. And we had to convince them. So the road safety community in my country played the game towards decision makers, towards politicians. And step by step, we were able to introduce this safe system approach. And we need everyone in the political arena, a minister, members of parliament, but also mayors, so all together. But the road safety community was the driving force behind that movement. And that means that you have to organize yourself to push on this political decision making. And this was a hard work. And if you have a success today, it does not mean that you will have a success tomorrow. You have to work on that all the time. Secondly, we were able to show success. And I don't know how well you all know politicians, but they love to show success. And the bottom line of safe system thinking is so strong that if you implement it, I can guarantee you success. And politicians love to see that. The third item, of course, is the question, do we have enough funding for implementation? And that brings me to the third item. We never looked for more road safety money. We were not looking for road safety allocated money. We were interested in the big amount of money available in the country for road construction, in the cities for town planning, because there you have a lot of money available. And the only thing you have to do is to see how you can redirect that spending a little bit. So we paid a lot of attention of trying to influence decision-making on investments in the country. And if we understand that, then we could make big steps as a matter of fact. So these are the three elements I would say. So political influence, success guaranteed, and how to invest money that we managed to influence and can explain why we were successful.
Thank you very much, Fred. I would like to turn now to Stuart and ask, in the case of London, it's a more recent case. where the safe system and the Vision Zero have been embraced. Have there been any milestone that helped move the political agenda? Can you tell us a little bit more what was the process there, Stuart?
I think it was gradual, and we were lucky to have the example of other cities to point to. I think the point's already been made about the value of international benchmarking and showing what is possible. In London, the Vision Zero agenda is, as you pointed out, Claudia, earlier, is entirely linked to the sustainability agenda. So for several years now in London, there has been a strong political consensus and support across the political spectrum for effort to ensure that people can walk and cycle, because these are active travel modes, they're sustainable travel modes, and they're beneficial to the city. And over time, it became very clear that fear and perceptions of safety, and in many cases, those perceptions were correct, were major barriers to unlocking that potential for sustainable and active travel. So a more progressive set of policies around safety, which regarded supporting and enabling active travel as part of the safety solution, as well as part of the sustainability solution, became possible. But I think the other thing I would say is that you can present these topics in a very technical way, with graphs and data and so on, and that's necessary. But sometimes, as organisations, and Transport for London is guilty of this, you can forget to add in the emotional dimension. And one of the things we have done as part of the implementation of Vision Zero is sought to build a coalition where there are many voices in the discussion, including those of people who have been the victims of road collisions and who have been had their lives changed or have lost family members. And I've seen the power of that when you bring those people together and bring those voices into the discussion with politicians, because it's easy for a politician to look away from a graph. It's very much harder for them to look away when they're speaking to a person who's been bereaved through road collisions. So I think that dimension is important as well.
Thank you very much, Stuart. And Eugenia Maria, how do you see the progress of the safe system approach in the leadership? You've been in the arena of road safety in Latin America for many years. Do you see that progressing in the right direction?
I would say yes. I'm an optimistic person. It's a lot of barriers, but I'm one thing that I think it's very helpful now, as from our Pan American Health Organization and World Health Organization, we are working together to put together the agenda of road traffic injuries with non-communicable disease. I'm working at the Department of Non-Communicable Disease. And so I think that's to move forward with safe system, it's very important, this contribution that we bring from the health sector for prevention of non-communicable disease. And so when you see the data in the Americas, for instance, we have the prevalence of obesity among men in 25% and the women in 31% of the obesity. And so when you go for overweight, we talk about the prevalence of 64% in men and 61% in women. And we also ask in our study about the physical inactivity, and the prevalence, it's 45% in women and 33% in men. And so it's very important for us to push for the safety system agenda as well. When we have this comprehensive view, what means, and so it means in terms of health, not only prevention of road traffic injuries, that's our main agenda with the partners today, but when we see about the premature death in the region, we have most of 40% of the people in in Americas died before 70 years old. And so to link everything, when we talk about to promote cycling, walking, we are promoting to prevention obesity, to promote overweight, to promote physical inactivity, that would be very useful for preventing all these diseases that we are talking about: cardiovascular cancer, respiratory disease, diabetes, and as well mental health, suicide. And so to move forward to this agenda, Claudia, I think it's very important to work more close in different sectors. And so that's our contributions that we bring from as WHO and Pan American Health Organization. And I'm very, very optimistic that we will move forward. And I'm very glad to see that to have this number of cities involved, and so can work close to them to promote also other healthy issues.
Thank you very much, Eugenia Maria. That's a very, very great point, that road safety is not separated from other important agendas. Now I will turn to Gothenburg, a relatively small city, but a city that is incredibly safe. So how has been the political road there, and what is your advice, Susanne?
Yeah, the political committee for the city is very important too. It's such a good thing that we have the Vision Zero funded by the Parliament, but you need to have that commitment on the local agenda as well. And I think for some 20 or 30 years ago, I think we built very good knowledge about the situation we had early access to hospital data and police data. So we could describe for our political committee what the problem really was when it comes to people, not only graphs and numbers, but what it really meant. And we have had the same political leadership for 24 years. And I think we had good support from the Social Democrats that were the leading party for all those years. But the last election, they lost the election, and now we have a more right-wing committee. And we need to restart our road safety work now, because I can see that this committee, they don't have the Vision Zero within their blood, so to say, and they're a little scared of the zero. So we need to educate them, and we have started that work. So the Vision Zero, we are going to take to propose to them to stand up for the Vision Zero on the city level. And I'm just about to start that work, so hold your thumbs for me. So I think Gothenburg, we have a success story, but we can also tell the story when you think you are very good, and suddenly you can see that you have to sort of restart and catch up the work again.
Excellent. Thank you very much, Susanne. I just want to remind our cities and countries that have joined that you can write your questions in the chat. I will be putting your question to our panelists as well. But before we close this very important piece on the political leadership and how we can get it steered off, I want to ask Matthew Baldwin. You are leading road safety for the European Union. Tell us, how do you see the conversation there? I see in your background 30, so what that means?
Well, thank you very much, Claudia. I've been so much enjoyed listening to all of you and your brilliant exposition of the safe system and hearing from the rest of the panel. Terrific. One point I want just to make on that is that sometimes I think we in this community, we confuse people by talking about Vision Zero and the safe system. And my take on that is that Vision Zero is our goal to reduce fatalities to zero by 2050. And the safe system is the proven approach, thanks to the revolutionary work of Klaus and Fred and you and others, shows us how we can do that. The second point I wanted to make listening to this discussion is to bring in this terrible word that we're very familiar with, and that's COVID. And I know we've all been very careful not to try to push road safety too hard during the COVID crisis because COVID's overwhelmed everything. But I think we need now is the time to make some of these points. If you look at the data, we are probably going to lose around around the same number of people on the world's roads as we're going to lose to the COVID-19 crisis. It's going to be close, but it's certainly in that order of magnitude. And we lose that number of people every year. The second thing is in dealing with the COVID crisis, of course, we subjected our economies and our people to huge stress through public regulation to save lives. And there haven't been protests, and well, there have, but the people have accepted it. They accepted the need for strong radical action to save lives. And of course, the last point is on road safety. If we can do that, we save money. We don't tank the economy. In the European Union, we lose between 1% and 2% of our GDP each and every year from road crashes. So road safety is a fantastic, cost-effective way of spending public resources. I wanted to pick up on a couple of things from the poll, Claudia, if I may. One was on data, and I was interested to see, I think data could be a bigger issue because we have to gather data in a serious and a careful way, and we can link that to the setting of strong and ambitious targets. I really urge colleagues to focus on two things in gathering data: deaths and serious injuries. Those are the crucial data points, if you like, in the safe system. We don't worry about road crashes. That's bumps in the street. That doesn't matter. It's deaths and serious injuries which are changing lives. And then you can establish for different groups, the vulnerable road users, the cyclists, the pedestrians, and we can learn within those different data sets. And it also enables you to set strong targets. I talked about Vision Zero by 2050. The United Nations system as a whole is committed in the second decade of action to a 50% reduction in deaths by 2030. The European Union committed to a 50% reduction in deaths and serious injuries by 2030. So we're really going to go for it. And as cities, you can do that now. You can set zero fatality targets. Helsinki's done it. Oslo has done it. They've achieved it, I should say. And you can link that, and this is the next point I wanted to make, about linking road safety and sustainable mobility together. Why not link that to your zero emission targets? Guess why? If we can reduce our dependence on the private car, excuse me, we can start to improve our air quality, reduce our CO2 emissions, improve congestion, reduce congestion, and improve our road safety records. And then the last point, if I can really be provocative, and I look at us on the panel, Claudia, I think we're a bit too much representative, not just of the global north, but even of the European north. And I saw on your poll that there's this sense that, you know, road safety or Vision Zero or the safe system is just about, it's a luxury item for rich countries. And my message to you all is, no, it's not. You know, we hear the variant of that wherever we go, that, you know, I can't make road safety or sustainable mobility work in my city because it's too rainy, it's too hot, it's too hilly, it's too dusty, or we don't have enough money to make that happen. If you look at the provision of sidewalks, or what I like to call pavements, but you call them sidewalks on your side of the Atlantic. If you look at the provision of sidewalks in cities, they're best provided in rich neighborhoods where people have cars. It makes no sense. We leave poor people without good pedestrian facilities, without bike lanes, without good public transit. Sustainable mobility and road safety are crucial items in the equality agenda, going back to the brilliant remarks from Klaus and Fred about linking these issues up with other things. If you go from Bogota to Brussels to Berlin to Bilbao, who this week became the first city of more than 300,000 inhabitants to insist on a 30-kilometer limit on all of its roads, it can be done. Everyone can do it. And we are delighted to be working with you in the Vision Zero Challenge for Latin America to help every city in Latin America do it too. Thank you.
Thank you very much, Matthew, for your thoughtful answer. So we have been talking about the political approach and how the people that are right now participating in this webinar, one of the main concerns that they have is when they come to their leaders and they talk about Vision Zero, that's the first barrier they have to go through. So we have a question from Daniela Gurdel. she's asking us your secret, and you might want to summarize it very quickly because you have said a lot already. How can political authorities be made aware of the need of Vision Zero in cities? How to make them see the benefits for the whole society? So I heard from, for example, from Fred, politicians love success, right? What can we advise to Daniela? Stuart, I think you want to go first.
Yes, thank you. Sorry for the background noise. My daughters have just returned from school.
It is okay.
So I think we've already touched upon this question in many ways. It's both the policy agendas are linked, and the point about bringing more voices into this discussion, because you're right. In London, there are many households where people don't drive. There are many many aspects of life in London that the population is concerned about: air quality, risk, accessibility. All these things are like satellites around the central challenge, which is that our city has become dominated by motorized traffic, and if we can reduce that domination, we can unlock benefits in multiple policy areas, and we can make the city better. And I think one of the challenges is to ensure that the voices of everybody that will benefit from these changes are heard by politicians, as well as the voices of those who believe they benefit from the current situation and wish to oppose change. And that's the challenge, because the ability to be heard is not always evenly distributed in society, and a more democratic discussion enables a wider range of perspectives to be heard. I remember, this is an anecdote, but I remember several years ago running a community consultation exercise around converting a local street into a home zone, a play street, and being approached by somebody who was concerned about losing their parking. And the person said, well, this is ridiculous. You're allowing children to talk, you're allowing children into this discussion. And it was a really interesting moment, because of course, why not? They live here too, it's their street. But this notion that some people have more right to enter the debate than others is a notion that needs to be challenged, because it's a very real assumption that many people make.
That is a very important point, Stuart. We need to listen to our children, and probably to our elderly too, to see if they are comfortable with the situations that we have in our cities right now. Very important. Anybody else would like to add something? I see you, Fred, raising your hand. Would you like to go first?
Yeah.
I see you too.
I think we can link this concept of personal responsibility and political responsibility, because we have to face the fact that many people in the world, also politicians, do believe that road safety is a major issue for a personal responsibility. And many times we are confronted with the 90% or 95% human causes in crashes. So it's the human being to be blamed for having a crash. And politicians, many politicians love to cite that. And in my view, that is the wrong concept. And what we try to do is create an environment for the human being in which we try to reduce considerably the chance of making errors. And we have to accept them, as you introduced to us earlier. However, we can influence that by creating a safer environment. And I do believe that we need Somebody talked about education of politicians. I'm careful in calling it like that, but we have to communicate with them about what's going on and what their role is. And then you arrive at this concept of shared responsibility, that is not just a human being, but also those who shape the environment of human behavior. Then when it comes to creating political pressure, what helped a lot in my country was the power of schools and parents. And then you arrive at your children. If you would like to have space for children on the street, if you would like to reduce speed in the residential areas, then you have the support of parents, you have the support of schools. And I recommend to work on that. Not, of course, when you talk about the main arteries, there's another problem. But when you talk about the far majority of the road lengths in cities, and we talk about cities without a traffic function, but with a residential function. And there you can change the environment completely. And if you go to the Netherlands, then you can see that, giving the example of Amsterdam, 85% of the street length of Amsterdam is 30 kilometers per hour. 85% of the street length. It's there. And it was not because the government was pushing a lot, but because the communities asked for that. And I would suggest that you use that as a power if you are interested to make a change.
Can I jump in?
Absolutely. Thank you, Fred. That is a very good advice. Go for Matthew.
Look, I'm sorry, there's a danger that we're all agreeing with each other too much, but I do think to amplify these points, it was a great book written half a century ago by John Kenneth Galbraith called Private Affluence, or coined the phrase at least, Private Affluence and Public Squalor. There's a really basic point here, which is that these sustainable mobility problems, these road safety problems are happening on public roads, publicly funded, publicly owned roads. These are public spaces. It is for governments, local politicians to decide if car parking is allowed. And just look at your average street and see how dominated it is by the car, where children can play. And we've seen, I think, some of this consciousness rising a bit, and exactly on Fred's points during the COVID crisis, where people started saying, I can't, this sidewalk's too narrow for me to walk safely down with the social distancing rules. How come these cars are all parked next to me? So I think it's a very important point to just remind politicians these are public spaces which they are regulating, and then exactly as Fred said, use local organizing. You don't get to the right to drive your car through my street, through my neighborhood where my children play. That is enormously effective. And then the other thing is the single most arresting statistic, which I've seen politicians affected by, is in relation to urban speed. And that is the following: at 30 kilometers per hour, 90% of pedestrians and cyclists survive being hit by a car. If you go to 60 kilometers an hour, which is the de facto speed that people are driving at, I'm afraid, in a 50 kilometer hour zone, that survival rate drops to just 10%. Any politician who's ready to stand up and say, I don't care about that, I'm ready to carry on having 50 kilometer hour speed limits in that context, I think we'll face quite a strong community backlash. But I think the world is changing. It's no longer forbidden to talk about reducing the role of cars in cities. I thought what Stuart said was very interesting, how that debate's shaped in London. It's changing here in Brussels. It can change in Latin America.
So true, Matthew. Thank you very much. And now I want to turn to a question from my dear friend, Luan Ferraz Chavez. He is joining us today from Sao Paulo. And his question is, when we try to reduce the speed and we try to put road safety infrastructure interventions, that seems to create more congestion, in particular when we give pedestrians more time to cross through the traffic lights. One very important argument that we have heard is that public transportation users are getting the worst out of it. So he's asking, how do we give basically pedestrians more safer time to cross the street without creating an issue for public transportation. And if we have been, discussing this type of issues, so I think I will turn to Claes and probably Stuart from London to see if you have any reflections on that.
Sorry, you said Stuart?
Do you want to go first, Klaus?
No, go ahead, Stuart. That's fine. Thank you.
Oh, okay. Well, I mean, firstly, I think a very careful balance has to be struck in sort of optimizing things like signal timings, but that's technically possible. And it's just a case of making a commitment to do that. So we have a program in London where we review several hundred, maybe even over 1,000 sets of traffic signals every year to try to optimize the timings of those signals for vulnerable users. And clearly we have legal duties to maintain traffic flow, so there is a balance to be struck. But it is technically quite possible to provide benefits and unlock benefits for vulnerable users without creating high levels of congestion. And I think the other thing is that we've begun to look at how we count people, not vehicles. And I think one of the, somebody once made a point to me, which I thought was a great point, which is that everything which is an advantage about walking in an urban environment is turned against people who walk. So pedestrians are very space efficient, so they're given less space. Pedestrians are very lightweight, so it's easier to send them up and over rather than to send traffic up and over at an intersection. Pedestrians don't cause congestion. When pedestrians conditions are congested, it doesn't cause air pollution. It's not so visible, and so it's easier to disadvantage pedestrians than motor vehicles. And one of the things one of the arguments we've been using is that, for example, on one of our key routes in the centre of London, we've taken space away from motor vehicles, and we've given it, in this case, to cyclists. And what we've found is when you count the cyclists, even though there is more congestion for motorised traffic, but you count the cyclists, there are more people moving along that corridor in the peak period. That corridor has become more efficient and a more efficient use of space. More transport for the same space is achieved, even though there is some traffic congestion. So I think we have to sort of, to some extent, free our minds a little bit and understand that our job is to get people moving around our city, not vehicles. So that's my reflection from London.
Thank you very much, Stuart. In the same line, we have a question from Alberto Navarro, who is asking us, how do we balance logistics, freight in our cities with Vision Zero? Are there any recommendations? And maybe I can turn to Susanne Anderson to see, how do you balance this work with big trucks and the need for us to receive goods and to take care of people?
Yeah, I think it's a very relevant question. First, for the city freight, we have regulations for the city core, both when it comes to weight and length and environmental to the motors and so on, for the lorries that go in the middle of the city, quite in the city center. So they don't have access when there are a lot of people, just in the morning and in the evening for deliveries to shops and restaurants and so on. And right now we are experiencing a huge development of the city center. We are replacing a bridge, and we are building a lot of offices and hotels and residential areas within the city center. So we have a lot of traffic for the construction sites, and they're really heavy trucks, and they are always in a hurry. So we try to regulate where they can go and what times, but it's quite difficult. So we sort of try not to make long turns for pedestrians and cyclists, but let the heavy traffic go on the outside, so to say, to the construction sites. And there is also a problem when a challenge when we are developing the city center, how we make it accessible for pedestrians and cyclists when we are building everywhere. But yeah, the heavy traffic is a problem. Yeah.
Thank you very much, Susanne. Any other reflections on how Vision Zero can really have a balance with moving passengers in buses and also having logistics?
If there's no one else, I've got just two quick thoughts. One is to say that there are some really interesting ideas going on how we can develop zero emission freight in European cities. There's a great project going on in Berlin called DOCOMO. Sounds Spanish, but it's in fact in Berlin. And the idea is it's working with the big parcel companies, you know, like the DHL, to bring their parcels in from the airports during the night, and then they go to depots, and then they're distributed by e-bike. It's a very interesting experiment because it's not just it's a small community effort, but the big companies are very interested in it. And the other point is to say that technology can help. In the European Union, we just passed new rules in our general safety regulation to make turning assistance compulsory on big trucks. And those rules will be phased in during the 2020s. And a number of cities are already looking at that, like Vienna and Berlin, to see if there are ways in which they can somehow regulate access to the cities to trucks that have got these special new features. It's got to go slowly because, of course, people still need their goods in cities to come in. But there are new ways of thinking about this. And again, set a target for zero emission freight and logistics, zero fatality freight and logistics.
Thank you, Matthew. Susanne?
Thank you. Thank you, Matthew, for reminding me. I almost forgot to tell you about the geofencing program that we have in Sweden. Geofencing is technology where you can regulate zones for speed, for accessibility, for what kind of fuel you're driving on. And we are I think this last week, starting a project called Smart Urban Zones, where we are going to have to demonstrate smart technology when it comes to heavy traffic on one street in Stockholm, and for the concrete industry to carry heavier load but in lower speed. And in Gothenburg, we are going to demonstrate how we can communicate with cyclists and heavy traffic close to construction sites. So thank you again, Matthew.
Thank you very much, Susanne. That is very interesting indeed. Cycling around construction sites is a big topic. So we will be observing how that works and hopefully will lead to great results. But I'm looking at the time and we have about 10 more minutes. So I want to shift a little bit towards one important question, which is the state system approach for rich countries? And we have had already a couple of important thoughts from Matthew telling us, you know, this is a place where you have Latin America, a lot of people walking and biking. This is really for you. And Fred has advised us look at the investments. There is a lot of money that is invested every year. So, you know, focus on that. I would like to ask you, Klaes, your thoughts about that. And I know this very interesting example from Sweden when you started with Vision Zero about the 2+1, right? So did you have a huge budget to do the safe system approach in your country? How did you go about funding?
Yeah, this is a very interesting question, because of course everyone said, you know, it's a great thought that we shouldn't be killing our citizens any longer. But hang on a minute, it's going to cost us a fortune. It's going to reduce our mobility, and people are not going to feel free any longer. And I think all of them has been proven to be very wrong. The cost of doing things is so much lower today than what it was 20, 25 years ago. All the economists said, you know, that it's going to be a reduced return of investment, and they said that that's a very important thing. I think it's been proven very wrong, because what we do today costs us so much more less. It's cost us so it's such a big difference today than what it was, both in terms of technology, but very much in the methods you apply. If you have lousy methods to reduce death and serious injury, of course it's going to cost you a fortune, because you're going to have to do a lot of that lousy solution. And that was a question about turning our quite narrow roads, instead of building autobahns for a fortune, we started to rebuild them, use the same roads that we had, and just put a mid-barrier on them and make it possible to overtake from time to time. Those roads costed, well, so little money in comparison to building new infrastructure. And I think it's the same in cities, who now, of course, in many, especially European cities, spend the fortune to rebuild them back to how they were maybe 30, 40, 50 years ago. And that's quite interesting. And if we don't do those kinds of mistakes, that we try to build them only for cars and maybe trucks, those who haven't done it maybe can avoid it. You're not going to spend a fortune to make them safer. But the other thing, of course, as many of you, and Matthew and Susanne has pointed out, of course, is that it's better to use other sectors' money to do something good with them, instead of asking for a big budget. And it's much better to sort of look in others' pockets. And because of, and now we have climate, we have equity, we have mobility, we have so many sectors, and we have the private sector, who has a massive opportunity to do positive things out there. So I think it's better to look for that, rather than saying money is an issue, because it's just going to be an excuse for doing less than what we actually can do. So that in short, but this, we could talk about it for a long time, but I'll leave it to you.
Very good. I like very much how you stress that is an excuse. And it is an excuse indeed. Thank you. I would like to turn to Eugenia Maria to tell us how much it costs in Latin America, maybe an estimate, to have all these non-communicable diseases. You know, what are the main diseases that people in Latin America die for that are related to being less physically active and to have bad air quality?
Sorry, I was muted. So I'd like to go back to my vision as a health professional, and so thank you for the question. And so I was saying in the beginning that 8% of the deaths in Latin America, in Americas, is due not to non-communicable disease. It means every 5 people that die, 4 are from non-communicable disease. And so this is mean a huge cost for the society, not only when you talk about deaths, but it costs also about the healthcare on our hospitals, on our healthy units. And so I think to talk about how to have better healthier cities, you have to consider everything related and the cost as well. And so when you talk about also the cost for road traffic injuries in our hospital, it's amazing. And so we have some statistics from the countries that's in some hospital, we have 70% of the beds are occupied by road traffic victims. And so this is a kind of a link that I insisted that's very important for us to talk, Claudia. And the other thing that I would like to add when I have the Daniela questions about how to convince politicians. And so I'd like to share some experience that we had in this region to work with the media, to training journalists, so to work together with this kind of people to help us to convince the politicians. And so I think it's a good experience that we had that I strongly recommend for the people from the cities to work close to the media to show them this analysis that we have, these benefits, the cost, and so the barriers. And so that's a big group that help us more in addition to the people that we talked before, to the children, to the elderly. And so to include this group as civil society representatives as well.
Very well said, Eugenia Maria. And yes, there is a big cost that we are already paying for the way we have chosen to live. So we have one more question from Jenny Montenegro, and it's about our professionals. And I will turn to Professor Fred Wegman to tell us how can we raise awareness among professionals to shift their way of thinking and to start designing safe systems. What can we do to get these young professionals to do it differently?
Yeah, when it comes to engineering professionals, it's my experience in the world that they have a very traditional education. It's all starting with the highway capacity manual. It's a little bit adding then with the highway safety manual. Basically, it is providing space for moving vehicles. And in my view, that is an old-fashioned idea. And I fully agree with Matthew on that. So we are moving to another world, and we need better trained professionals. And where are they coming from? They are coming from the universities. So I'm looking for professors at universities educating our new engineers and new planners in a more modern way. And this modern way is not just giving more space to motorized vehicles in cities. I'm afraid to say that those who believe that we can solve our transportation problems in cities by giving more space to motorized vehicles, that's an illusion. That's not going to happen. It should be the other way around. We have to give more space to cyclists, to pedestrians, and to public transport. And nevertheless, we have to deal with the problem of congestion because we have that problem. So we need a new way of thinking. Technology is going to help us a little bit, but more importantly is the awareness of the citizens, and moreover, that there is a serious alternative for sitting in your car in a congested area. So build that alternative so that people use that alternative and make it attractive. And there are several examples, and I experienced a lot of congestion I've been to Santiago de Chile, I've been to Bogota, I've been to Buenos Aires. It's amazing congestion, but I hope that all the examples I've seen in these cities, by adding space, for example, in Bogota to cyclists, and just step by step doing that and building an alternative. And I hope that the professional training will help us in the future on that. And that's really needed in Latin America, is my opinion.
Thank you very much, Fred. We are at the end of our webinar. I just want to thank you so much to our panelists. We have more questions. We can, as Claes said, stay for hours on end really talking about this topic. This is not the end. We are gonna definitely continue this conversation and provide a bridge to these brilliant people that have so generously given us your time. I now want to call my colleague Ariadne to help us with the wrap up of this first webinar. Thank you, Ariadne.
Hi, thank you, Claudia. So I'd like to congratulate all the panelists for this amazing panel. And I'll just recap briefly our top 3 challenges from the poll. So we had first the perception of road safety as a personal responsibility, and then the lack of political leadership, and the perception of safe system as a luxury for rich countries only. And so just highlighting some of the comments in this panel, I would like to comment on the commitment at city level, and now congratulate all the cities that are joining us in this challenge because they are now doing this step. Also, the way to link road safety with the sustainability issues, not acting and thinking of road safety just as one isolated sector. And very important, giving voice to local communities so they can also help us demanding the change that we need in our Latin and Caribbean cities. Also the benchmarking and using the previous successes of other cities using this approach in a way to achieve and in a way to engage our politicians. Also focus on the data to help us to set the goals. We heard here that focusing on the death and serious injuries will also help us to set the 0 and the Vision 0 goal. And last, not using money as an excuse for not doing it, but thinking about reallocating the existing funds that we already have. So I would like to thank all our panelists, Class, Eugenia, Fred, Stuart, Suzanne, and Matthew for this amazing panel. And I would also like to talk about our next webinars. And so if Wes can just, okay. So thank everyone for joining us in this webinar. This is the first and the initial steps for this amazing journey to make Vision Zero a reality in our Latin American cities. We have 4 more webinars scheduled for this year. Our next webinar will be on October 8th, and we will talk about the emergency bike lanes. It will also be a question and answer webinar like this one. And then the next webinar will talk about children and road safety. Wes, I think we can change the slides. Then we'll talk about speed management. We heard that speed is very important issue in this road safety theme. And the next one will be using data to support the safe system. And the last one will help in December 6th. And then we will just see the next step of this challenge in 2021. So for everyone, you will receive, after this webinar, you receive the link for the registration in the next webinar, and keep joining us in all webinars. So just like to thank everyone again for joining us, and I'll just give the word back to Claudia. Thank you.
Thank you very much, Ariadne. Just very grateful for you, Claes, Stuart, Susanne, Eugenia Maria, Matthew, and Fred to have joined us, and for all our cities to give their time to road safety. I also want to thank very much my colleague Anna Bray. She's been working together with Wes Holm, my colleague Veronica Linares, and all the colleagues that you see here to make this possible. Thank you so much. Have a wonderful weekend and stay safe. See you soon. Thank you.
Thank you.
Thank you. Bye.
Thank you. Goodbye.
Thank you. Bye-bye.
Susanne.